Okay. Well, this last panel is between you and your festivities for the rest of the night. I think you'll find it interesting and different, probably, than the rest of the meeting has been so far. Dr. Koulivaris is going to just present a few comments and then a short video from the Niarchos Foundation.
Thank you very much, Dr. Skolko. Health is the main focus of Stavros Niarchos Foundation. So we can see a small video, please.
So, I'm Thomas Skolko, the Surgeon-in-Chief Emeritus at the Hospital for Special Surgery in New York, and affiliated with the Weill Cornell Medical College. HSS, for those who do not know it, is the largest musculoskeletal center in the world. And the common thread of our speakers today is that each of us has spent time as part of our medical education at the Hospital for Special Surgery. Dr. Hannibal Aji Boyachi, who you'll meet shortly, and Dr. Takis Koulivaris returned to their home countries, and Peter Skolko, my son, and myself have remained at the Hospital for Special Surgery. It is wonderful to be here in Athens and to share these unique humanitarian programs which the Niarchos Foundation has been pivotal in helping to create, and which would not exist if it was not for their mentorship and generosity. For the last 2 days, we've heard an amazing group of speakers talking on an incredible range of topics impacting on humanity and highlighting the risks, challenges, and successes that our world poses each day. We have learned a great deal, and we go away hopefully energized to shake our individual communities and effect meaningful changes. The Niarchos Foundation has been the driving force behind much of these dynamic societal changes, and we all thank them for making this spectacular Summer Nostos Festival possible for an interaction and an exchange of ideas which are very provocative and therefore typically very Greek. It is always incredible to me that not only in Greece, but throughout the world does the Niarchos Foundation show its visibility and its partnerships that help so many areas of mankind. And this is particularly true in the area of healthcare, which you just saw in that video, and which we'll elaborate with some of these programs here this afternoon. This final session will look at the tremendous vision of the Niarchos Foundation to help with 3 international health care projects on 3 continents in 3 very different environments. Each of these programs is producing tremendous good for populations of patients in need. For the next 45 minutes, we will introduce what these programs are, how important they are, and how they would not exist without the Niarchos Foundation. So I'm going to have each of our speakers elaborate on their incredible endeavors, focusing on how they are providing needed care to underserved patients throughout the world. Our discussion will then focus on the role of philanthropy and innovation in healthcare. So what I'd like to start with is my dear friend Oheneba Aji Boyachi on my left. Dr. Boyachi was born in Ghana, received his medical and orthopedic education in the United States at the Hospital for Special Surgery, and was chief of our scoliosis service and a renowned spine surgeon in the world. He ultimately returned to his home country, Ghana, building an orthopedic hospital, which is now a center in Africa for spine and joint replacement. Oheneba.
Yeah, thanks, Tom. I appreciate, and I really want to thank the Niarchos Foundation for the invitation to participate in this amazing conference. I've learned so much in the past couple of days. I always go home with more than I bring with me, so that's a plus. As Tom said, the common denominator is the support that we've all received from the Niarchos Foundation. Question for me is, after 20 years in orthopedics in New York City, where everything was bright and shining, why would I go back to Africa? And I had an argument, I would say a debate with my wife. I went to the United States at the age of 21 to become a doctor so I can go back. At some point, I saw myself as overqualified because I figured if I went back, I'll have nothing to work with. So I talked to my wife, honey, we cannot go back. And we debated as to how we're going to go back. So the question was, in the United States, healthcare is a right. Everybody has healthcare. If I press 911, the ambulance will be at my doorsteps in 4 minutes. In Africa, if you press 911, you're dead because it won't come. So it becomes a privilege for those who can afford health care. And the governments are inundated with public health. 60 years ago, what almost killed me was infectious disease, malnutrition, and malaria. Today, it's the same thing. So the governments are spending all the expenditure on public health. But people are living longer, we're developing arthritis, we're breaking bones, the roads are very bad, there's horrible infrastructure. So there's a lot of trauma, but you go to the hospital and they're all lying there with your broken bones. People are developing diabetes and cancer. So if we're spending all the expenditure, and by the way, the government expenditure on health is just 3.5% of the GDP, which means every citizen is entitled to $80 per year of health care. Now, $80 might get you a malaria pill, but it won't fix your broken hip. So going back to do orthopedics, to me, was overqualification. So we figured the only way we can do that is to have a paradigm of public-private partnership, and that is to get sponsors, supporters, philanthropists to buy into the vision that we can turn compassion into action. And 20 years ago, we started these medical missions. 10 years ago, the Niarchos Foundation supported us in building an orthopedic center of excellence in Accra, which now has treated over 60,000 patients, performed about 3,000 major reconstructive orthopedic procedures at a fraction of the cost. So an operation that will cost $100,000 with the support of medical industry, devices, donations, and philanthropic help and sponsor patient, we can reduce it like, say, $10,000 to $20,000. So the philanthropic aspect of healthcare is so critical, and that there has to be a hybrid of a private-public partnership to make it work. It cannot be all public, and it cannot be all private. There has to be a hybrid of the two to make this work, and this is where we see the collaboration and the efforts of the Niarchos Foundation, the governments the governments that we are in, the states that we live or participate in, bringing this to fruition and making the world stand tall.
Okay. a truly amazing accomplishment to go and establish a center of excellence in a very difficult environment. Now I want to introduce Takis Kouvalaris. Takis is a native of Greece, trained here in Greece, and came to us at the Hospital for Special Surgery and spent 4 years as both a clinical and a research fellow with an interest in joint replacement, returned to Greece, and has not only been an outstanding academic orthopedic surgeon, but has really, with the help, again, of the Niarchos Foundation, established a public health system and network throughout the country and the distant islands. So, Takis, perhaps you could just elaborate on your program, which is truly amazing.
Thank you very much, Dr. Skulko. I have to say that it is a relationship of 15 years now, and more than 150 surgeons have been at HSS, thanks to the generosity of Stavros Niarchos Foundation and to you, of course. So we have to agree that health care is a right. It's not a privilege. It cannot be a privilege if a 10-year-old girl has leukemia, it needs cancer care for months of years. It is a right, but how much treatment could we expect to fund? And how much medicine? And we need to define who will be the service of this merit. Who will be the public or the private, the academic medical centers? Who will be? There is political will, of course, there is financial assistance, but I believe academic medical center will have the leading role of providing access for everybody to health care. Healthcare is a right, it's not a privilege, but we need to define the role of our medical centers to help the people who have the need. Starting from this point, what we did here in Greece in 2014, we had a research for 24 small islands. We published. They didn't have any access to healthcare. The inhabitants need to travel 10 to 15 hours to find a doctor. And there's no woman to have mammography since 2014. There are about more than 50,000 inhabitants in these islands and more than 5,000 kids. So we set up 2 mobile hospitals that they traveled once a month in these islands. And since January 2019, we have 3 missions a month. There is a pool of 80 doctors and nurses and paramedics. And we believe that health is not hospital, doctors and nurses. Health is to have full access to healthy food, to social economical role for their lives, and also to help them to change their lifestyles. That's why we published, we found more than 40% overweight and obese kids, and also we found that only 3% of kids know safe swimming. We published that. We hired teachers of physical education, more than 200 the last 5 years, and they work with the kids. We have summer camps, 3 months summer camps, and we have 10 months during the winter, special physical activities for the kids, for these small islands.
You might just mention to the audience the number of, I was amazed at how many people are involved in the program and what the budget is for the program on a yearly basis. It's truly remarkable.
The budget?
Well, yeah, and also the number of people you have involved. There are hundreds of people involved, from people who drive the mobile units,
yes,
the
yes,
doctors,
yes.
the nurses, the therapists.
They need to travel to Athens. They need to stay 2-3 days to have the examination and then to go back. It was very difficult for them, so they prefer to stay without any primary care. That's why we addressed these needs with the 2 mobile medical units and with a team of 35 to 40 doctors in every mission.
All right, so the third speaker, just again to introduce these different programs, which are all different but have commonality. Peter Skulko grew up in an orthopedic household. and is a hip and knee surgeon at the Hospital for Special Surgery with a specialty in patients whose operations have failed for one reason or another, and they've needed a second procedure. And really, to a large extent, the concept of this center that was created was Peter's idea in terms of difficulty patients were having access to care with these complex problems. So Peter, why don't you, we have a few slides and you want to maybe just say a few words about the center.
Sure. So, so pretty much it was, at the dinner table, hence you grew up in an orthopedic household, that over discussions of your experience, because you've been in practice for, several decades, and I was just starting practice, that while the hospital did, over 10,000 primary joint replacements a year, and several of these redo surgeries that are quite complicated, there was a continued unmet need. I think we're noticing a common trend that there's unmet needs in healthcare, and that can be in Africa or that could be at the #1 hospital in the United States. There's unmet needs in regards to patient care, and we decided to put our focus towards patients who had failed their joint replacements, and we all like to talk about the success and how great our outcomes are, but there's a large number of patients who don't do that well and need treatment, and sometimes they are the most complicated situations that require the most resources. So that was basically the initial idea of how to improve clinical outcomes, utilizing our resources, improving the research in these complex procedures, and also train other surgeons, both locally and internationally, how to take care of these problems at home. So we learned yesterday about the power of storytelling, so I thought I would just show a case, and there is one slide, I'll give you warning, that's has a little bit of, it's an intraoperative photo, so if you need a little wake me up, you can look at it, or if you're squeamish, don't look. But basically, just to reiterate, these are the 3 tenets of any academic center, which is clinical care, research, and education. These are the pillars that we decided to build the center on. I'll just show you that, this is a simple graph showing that, there's over 1 million joint replacements done in the United States alone every year, and around a 1% revision rate, so you can do the math. And this is a cumulative revision rate, so as every year there's another million, patients who are walking with hip and knee replacements, and over time, things fail. We're in a very mechanical specialty. Tires wear out, just like your joints wear out. Sometimes our devices can wear out, and then they can get infected. There's a number of different ways that things can fail, and this is a graph from a national registry in Australia showing you how things fail over time. So it's a big problem, and there's an estimate of over 100,000 revisions per year in the United States alone, so it's an increasing problem. This is just a narrative on a lady who is 65 years old, and this is her x-ray, and you might not know x-rays, but basically I'll just tell you that she has 2 implants we don't use anymore. They're from the 70s. They're the first successful hip replacements ever done, actually, and they lasted several decades. She had rheumatoid arthritis, had surgery in her early 20s, and lived a happy life for many decades. And basically then these both wore out, and there was a significant amount of what we call bone loss in the pelvis and migration of these implants, and basically they were loose, everything was loose, so she was on a walker, basically taken care of by her 2 sisters who also had rheumatoid arthritis, basically could barely leave her home, and was looking locally for care. And this is in the East Coast of the United States, and basically no surgeon wanted to address this problem because it requires a lot of resources, high risk, cost of the hospital, low reimbursement, and many factors we can talk about for why she wasn't treated locally. Her sisters actually did some research online and found the center, and then looked up my office, and I saw her with her sisters there, and we came up with a comprehensive plan for how to treat this problem. And it's not simple. There's many ways to solve it, and there's probably in different areas of the world we solve it differently. We can talk about innovation and how we address innovation to solve these problems, but basically we make a 3D model of her pelvis based on pre-op imaging. You can even print these now out of plastic pretty simply, and 3D technology applies to our field like many others. And then basically we make an implant out of titanium, and we plant it, and this is basically molded to fit the specific problem that she has, and it's customized to have this titanium basically wrap around her bone and find where the good bone is and ignore the areas where the bone doesn't exist. Basically, then they tell me exactly how many screws I'll put in and where they're going to be located. So at time of surgery, I have a very good plan, and planning and execution is important whether you're doing magic tricks or doing surgery. It's about planning to make complex things appear simple. And that was the goal here. And then this is the gory photo, sorry I didn't give you warning, of basically just showing this titanium implant that's custom made, basically replacing worn out bone with metal. And this allows her to walk and to get rid of that pain. And so that's basically what we're able to do today with 3D printing technology. And that just shows you basically what the x-ray on the left looks like. It looks like a lot of white, and that's all titanium metal in both the femur. But that allows her to walk, and I'm doing the other side basically when I get back in a couple weeks, and we have a custom implant made for that side. And the benefit for her is obviously that her quality of life, and she'll get out of the house and get back to her activities as the hope. So that's just a little background, I think, of that patient is really the driver for why we created the center in the first place.
Peter, can you give us an idea how much this will cost?
That's a great question. So currently today, and we can talk about innovation, and I think that in what it'll cost in 10 years from now. I mean, today, that total is probably $20,000. It's probably $12,000, between both components. The implant in the pelvis is around $10,000 to $15,000. Obviously, this requires public funding, and this is government funding for this. We can talk about the innovation section, but I'd say my first flat screen television was $3,000. I couldn't afford it, but it was like to buy a flat screen was going to cost you several $1,000s. Now the same flat screen costs $400. 3D printing now is becoming more common, where you can buy a 3D printer for a few $100s. So I'm hoping that as time goes on and it becomes more universal, this can be done for lower and lower cost. And I think that's an important topic, I think, for this discussion.
I think one of the goals of this center, just to speak to it for a second, is that in the United States, there are many surgeons who can do a primary hip or knee replacement well. They're well trained, they have a lot of experience during their training, and they can probably do a good primary operation. The problem we have is, should that fail for one reason or another, and then the attempt to redo that operation, which is far more complex, and these situations, they have far less experience. So many will try to tackle those problems. It'll fail. Patient will have an infection or some other complication, lead to a third operation. And so the concept of this center is to provide a place, a space, where we will take these patients and deal with them early on to prevent this cascade of failures, which in the long run will be far, far more expensive to the healthcare system than if they're dealt with efficiently and well early on. So that's the concept of that. So I want to just open up the discussion a little more. The Niarchos Foundation has been crucial, and philanthropic support has been important to all three of our programs. And I just was wondering, Obi, in your case, if you could speak to the importance of philanthropy in the United States. Philanthropy is key to what we do in the healthcare arena. Not so easy in maybe other environments. And Obi, maybe you could speak to that a little bit in terms of the concept of philanthropy and what it allows you to do that perhaps you could not otherwise do.
Yeah, Tom, very good question. And actually, without philanthropy, we could not survive. We will not be able to build an orthopedic center of excellence that is now seeing patients from 53 countries, mostly from Africa, because the cost will be prohibitive for these patients to come and receive the type of complex orthopedic care that they need. Without the support of medical device industry companies giving us products, and our three X-ray machines at the hospital were all donated by the Hospital for Special Surgery. Our CT scan was donated by the Hospital for Special Surgery. Our MRI scan was bought by a foundation, the Ghana National Petroleum Corporation, and a donor from New York. So without these individuals and companies and entities coming to our aid, there's no way we could afford to build it, because it is not the priority of the government to build tertiary care institutions of this magnitude that is taking care of patients with complex spinal and orthopedic conditions. Their concern is on malaria and infectious diseases. So philanthropy is so crucial that even going forward in terms of sustainability, I've been able to train the only 3 spine surgeons in the country. And that's why I can be here, because they are working. You train the only Ghanaian joint replacement surgeon, and he's working, so I could be here. But going forward, we need to build capacity in education, research, outreach. We go to Ethiopia and see patients. Those who have sponsorship, we'll bring them and operate on them, and they are sponsored by the American Jewish Joint Distribution Committee. Patients from Sierra Leone are sponsored by African Surgery Incorporated. Just before I came, there was a Seeds of Hope sponsoring a patient from Kenya. So all these patients are coming for care because they have sponsorships. And as we speak, there's about 3,000 patients on a waiting list who need surgery, but I don't have the implants and all the funds to be able to support them. So to have a sustainable program into the future will require something like an endowment, that which proceeds we can use to hopefully support patients, build capacity, support operations, and upgrade equipment, and be able to train more future surgeons. Because Ghana has 29 million people. Guess how many orthopedic surgeons? 30. You know, Nigeria has 100, 200 million people. There's probably 40 orthopedic surgeons. So there's a lack of manpower, there's a lack of infrastructure, and there's lack of funding for specialty services. So it's only going to take philanthropy, private-public partnership, to be able to meet the future needs of the population when it comes to musculoskeletal health.
You might speak also, Takis, because
Sure.
without philanthropy, again, your program wouldn't exist. And as an extension of that, you know, one of the good things about philanthropy, aside from the support for these programs, is that it stimulates, hopefully, the government, other organizations to contribute, other individuals who have means to contribute and help sustain these programs. So would you speak to that in Greece?
I would like to keep in mind when we talk about healthcare, the three factors: accessibility, timeliness, and affordability. We all want to have an insurance when an event, catastrophic event, happens in our life, some days in ICU, and we would like to afford this care. So I believe philanthropy plays a crucial role to combine the private sector with the public sector. And I believe, at least in our country, innovation is very difficult to come for public hospital, for public system. They need help. They need help. They have a lot of patients. We have a lot of patients in the emergency department without insurance. And as you know, emergency department is not a good field to see the insurance patients. It needs primary care, and it needs prevention program. A noteworthy example is Johns Hopkins Urban Institute in 90s. East Baltimore in 90s had the highest syphilis, the highest diabetes, the highest cardiovascular disease. They has many drugs abusers. So what they did, they established the Johns Hopkins Urban Institutes by many philanthropic actions. And what they did, they had 3 steps. They strengthened the society with the hospitals. They did research projects and clinical projects, such the grandmother's project for the kids whose parents no longer care about them. They service the grandmothers. They had service for the people with HIV. They promote economic growth of the area. So the medical center, the academic medical center, had the leading role. However, the philanthropy gave the actions, the motivation to help all the people.
You know, in terms of speaking about innovation, I mean, this program you've established, again, with help, with support, you have an electronic medical record, basically, which the healthcare system in Greece does not have, but you've been able to implement it to track these patients, even though geographically they're very diverse throughout the country. So speak to that a little bit, because that's very innovative.
You know, it is pity to say that in our hospital, University Hospital, we don't have electronic medical record. However, in mobile medical units, we have all the records, all the data of more than 40,000 patients during the 5 years. So I can find the X-ray, I can find the mammography. Every year, we can follow the patients. Now we try in our hospital also to have the medical records. As you know, it's very vital to keep the data of your patients. We are doing the same with the athletes. We follow the athletes We establish the card of the athlete, that they are healthy to compete, and we follow them. And we also have many education seminars for the parents, for the athletes, for the people, how often you need examinations by the doctors, why, what, and how often. We need to ask all the time, why, what, and how often.
So, Peter, you might speak to innovation. You showed some of the with these custom devices that we currently make. But how does a center like this stimulate innovation in what we're trying to accomplish?
Sure. Well, I think philanthropy. It depends on the institution where you work, right? So, philanthropy can be used in a variety of ways. Whether it's more for operations, right, to run the actual hospital, to deliver patient care, or can you use that money more for, let's say, research and education, because a larger portion of the operations can be covered by payers, by people with insurance. So let's say with the philanthropy in our case, putting it towards all three of those pillars I mentioned are interconnected, but I'll talk a little bit about how philanthropy, what does that generate? Generates the ability to have very close follow-up of the patients that we're treating, meaning in the OR, before surgery, at the time of surgery, how we follow them after surgery. It's exceedingly difficult in healthcare to follow patients after they leave. This is the case for all specialties, is how patients do when they leave our direct care. And there's a lot of manpower required to maintain a valid database. And I know it sounds boring, but in this day and age, data, as we know, is king. And data is time-consuming and costly to produce, and everything is about good data, you put in, good data, you come out. I'll relate that to innovation because I think that over time, when we generate now 2,000, 3,000 revision surgeries that have been done with supported manpower to get good granular data, you can start to create this data in a cloud. You can start to come up with algorithms. You can start to employ AI, which we've heard about, and neural networks and decision trees. And then you can start to share that power and that data with the world, right? So you utilize philanthropy at a high volume revision center in New York City, but then you can share the data that is accurate, that can generate powerful algorithms that can be used by anyone who's facing that same case that I showed you. What type of implant should be used, post-operative antibiotics, how long should that person be toe-touch weight-bearing? You can list 1,000 variables that when you look at it in aggregate can influence someone's outcome. So philanthropy generates good data generates innovation is central and then is spread elsewhere.
Obi, even in a center like yours, you've been able to specialize it and provide unbelievably high-level tertiary care to your population. So do you want to, you have a few slides in terms of some
yes,
cases.
I do. And this really points to innovation and necessity being the mother of invention. If I can have the slides.
There.
So this is what we face in Africa. And I didn't see these cases in New York because these patients would have been seen when they were young and they would have been treated way before they got here. A lot of these kids will not live past the age of 25 because they will be all dead because of the compression of their lungs. So how do we manage these patients? We had to think outside the box. A lot of these patients, if they were seen in New York, will require 2, if not 3 surgeries. Now, and there are also some cases that I never had a label for. They were not described, so very appropriate here to be untitled. But interestingly, when I went through some of these cases, I likened them to the Greek alphabets. So we have the omega curve, the alpha curve, the phi curve, and the gamma curve. And I actually got it published in the International Medical Journal. But it requires thinking outside the box to be able to come up with these. But then what do you do about them? The conventional methods of treatment that I applied in New York did not work. So we came up with a scoring system that also got published, and we did is basically following these patients and creating databases for them, and then realized that if we can mitigate the risk, we can mitigate the risk by instituting a method that was actually popularized by Hippocrates in 405 BC, and that was gravity traction. So we designed these modern gravity traction systems that allow patients to stay in these devices for, say, 6 months. There's no way we can admit a patient to special surgery for 6 months. But on the sprawling campus that we have in Ghana, we can have them for 6 months. And we have a school where they can also be taught. They didn't have to actually become immobilized because there was a mobile mobility interaction. So this is something that I designed to be able to get these patients unwound. So basically, we're trying to unwound the spine before we can operate on them. Because each of these operations, if we were to do them in New York, will cost at least $250,000. And it's very, very, very high risk. So by doing this, you can see how patients had gone from pre-traction to 20 weeks in traction. So the spine has actually unwound to the point where we can safely perform just one single operation, and not 2 and not 3. So you see how the curve has gone from 129 to only 81 from both the side and the front view. So a kid like this coming in would be taken through this kind of innovative treatment program, and then we'll be able to show that he was sent by his physician with this height, and he went back home with that height. And this is all using methods that have never been described and can only be done by thinking outside the box, being innovative, applying these clinical principles. And this is what also is very good for outsiders. We have a lot of volunteer surgeons who come to our center who have not seen these in their facilities. So we are a training, research, and education institute, providing innovative methods to treat the most complex of spinal diseases at the most affordable cost.
So these are, we had somebody here who was a magician before, but here is a surgical magician who takes unbelievable deformities like this and can correct it in these children. So, Obi, tell us a little bit, and I want every one of the speakers to comment on this. One of our missions as orthopedic surgeons and academic surgeons is to really train the next generation of surgeons who come after us, as well as train surgeons who are out there in the world who may not be as conversant with some of the things that we do. So speak a little bit about some of the people who come and how you are training people to follow in your footsteps in terms of these spinal deformities.
Yeah, so when I was in New York, I trained about 300 spine surgeons. Papadopoulos, who's a spine surgeon in this city, was one of my fellows. Takis visited me once in Ghana. And then going back to Ghana, there's been about 500 volunteer surgeons, nurses, and therapists who've also come for a week or two of helping provide the service. And now our goal is to be able to train the next generation of orthopedic surgeons in Ghana. Luckily, with our collaboration with the Hospital for Special Surgery, we send residents to New York for fellowship training. We had Joseph train in arthroplasty. Now we've trained 2 spine deformity surgeons in Ghana who are also Scoliosis Research Society members and have also presented. So what we like to do is to continue to build capacity, develop the infrastructure, and be able to support patients who don't have the means to receive this highly specialized care. And it was going to take a huge endowment to be able to do that. But I believe where there is a will, there is a way. And with the support of NEAHOS and others who have come to our aid, I believe it is possible. Mandela said, it seems impossible until it is done.
You might want to follow up.
I have a question, Dr. Blatz.
You might want to follow up, Takis, and also speak to how the Niarchos Foundation is helping to educate surgeons here in Greece with the collaborative relationships that we have with Greece and orthopedic surgeons, and how now you're expanding that to some of your trauma relationships where trauma is more common, let's say, in South Africa.
Yeah, first it was 2005. We were in the OR. It was Saturday, I remember, very late, as usual, 1:30 in the night. I was so happy with you. the teaching experience in the hospital, at the Hospital for Special Surgery. Then I asked for the Stavros Young Foundation to open this experience to all Greek surgeons. And you were welcome. And thanks to the generosity of Stavros Young Foundation, we start all these years, this deep relationship. However, when I met Dr. Boachi, he was the chief of spine. He had the power. And I would like to ask you, I have asked you many times, we had 3 missions, thanks to the generosity of Stavros Young Foundation in Ghana. Which was your motivation to take the power of New York and to help all these people in Ghana?
Yeah, that's a good question. I've been asked many times. You know, and it goes back to a dream that I always have, that I'm driven out of school because I haven't paid my school fees. So why is that? But this happened when I was in high school because my mother couldn't afford my school fees. So I'd always be sent out of the school and I'll go home and I'll copy textbooks. So one day I told my mom, let's go and make a deal with the headmaster. So she said, how are we going to do that? I said, well, you sell smoked meat, right? You sell smoked fish. So let's take your best smoked fish. Let's go see the headmaster. So we went to see the headmaster, and the headmaster received the smoked fish. And my mother said, you know, this is my firstborn. I like him to get education. I can't afford it. So give me a payment plan. So the headmaster gave us a payment plan, and she was able to keep, it was only $14 a year. But we need a payment plan for $14 a year. So
how many fish was that?
A few fish. So I was able to get through that. Prior to that, I had been sick for about 2 years. And we're talking about infectious diseases. And I was actually considered not to be alive because I was so sick from a poor family that I wasn't going to live. And I did not see my father until I was 10 years old because I had no male figure in my life. So when I got sick to the point where I almost didn't make it, my grandma said, I think there's a doctor who's come back from England. Let's go see him. So we went back into the city, and this doctor said, oh, this boy is very sick. So he admitted me, he took care of me. My grandma started crying. And he said, why are you crying? He said, we don't have any money. He said, don't worry, I'll take care of him. That was my first experience of philanthropy. He became my father, he became my role model, and I promised I would be like him one day. It took 40 years. So that stayed with me. It never left me. You know, and so with that experience, I promised myself that one day I'm going to give back. And luckily, with my training experience and making some money in New York, I was able to start the foundation, put down the seed money, get friends and families to support. And the Yahoo's came to our aid. We built our first operating theater, and we'll continue to build. And that's the reason. That's the drive.
It's great. It's an amazing story. Peter, you might just speak, you know, we have about 2 minutes left. You might just speak to the concept. We had a symposium, a consensus international group that met last week that the Niarchos Foundation is responsible for. You might just speak to that and how it may impact on global orthopedic care.
Sure. So first education, I'd like to say that we have 2 physicians in the audience who spent time at HSS, Georgios and Michael, and they're both supported from Niarchos. And Georgios spent 2 months actually as Takis' resident, and Michael's spending a year with us doing research. So, you know, the education is here with us today. I think they're superstars, and I think will go on to great things, and are I think having a great time with us. So, you know, the education platform is not just for, you know, high volume revision surgeons, but also for up and coming surgeons who want to go into this similar field. In terms of the consensus meeting that we had, we basically invited 35 physicians from around the world to come to New York City to discuss one single topic, and which is basically similar to a case that I showed. And the goal was to try to bring in people from Europe, from Australia, from North America, and basically to try to come up with some consensus or research questions if there's a lack of consensus about what's the current best approach to handle tough problems. I think the benefit of the meeting was that it was industry free. I think that that's one thing we could talk about with philanthropy. It frees us of other sources of support, which often is industry, which comes with a certain amount of bias. This was just people sitting in one room without a company label attached to it and having free discourse among each other openly in a good space. And then we're going to put together a document that we're going to share with the world, basically. So I think that, it's another example of utilizing philanthropy, putting it towards education, and then utilizing those minds to help others.
The story continues. We have the seminar for 20 Greek orthopedic surgeons, and we have the fellowship. The story continues, okay?
So, our time is up. We have remarkable programs, remarkable people, and I'm glad we had an opportunity to share this with you. But again, since this is the last session for the day, I can't emphasize enough, my ancestors actually were Greek, but I'm so proud of really what the Niarchos Foundation does, and I hope that people in Greece realize what an incredible, really world resource this organization is, and the amazing good they do throughout the world. So thank you for inviting us, and it's been wonderful being here.
Before I ask the president of the Stavros Niarchos Foundation, Andreas Drakopoulos, to come and give closing remarks for this year's conference, I would like to say a couple of things. I would like to thank all of you who have attended for the last couple of days. I know we had 2 full days, and you have stayed with us, and we appreciate that very much. This is the 8th year, and it is remarkable to see this group that comes to the conference year in and year out growing, and it is also wonderful to see new friends this year. I also wanted to thank everyone on the side of the foundation who has worked very, very hard over the last couple of days. I would like to thank our hosts, the SNFCC, that have helped us throughout this endeavor, and also all the members of the production company that have done a wonderful job beyond the call of duty. I also would like to thank Dina Argyropoulou, who has been graphically recording both days of the conference. This is her graphic rendition of what happened today, and I would encourage you to walk on stage afterwards and take a look. She has done a wonderful job. A couple of things from my end. When I think of this conference, I think of the flow of a regular day. There are good moments, there are less good moments, there are exciting moments, there are less exciting moments, there are noisy moments, there are quiet moments. But as long as we manage to find some meaning within the day, everything makes sense at the end. So I hope that you did find meaning throughout these 2 days, here or there, in what you experienced. And again, we say farewell, and we look forward to having you with us next year. Andreas?
It has been an exciting 2-day journey and quite fulfilling, as Telio said. And I think we have all succeeded in opening a bit wider the crack in everything that, as observed by Leonard Cohen, lets the light in. What these moments all have in common is a genuine human element at their heart. The serendipity, spontaneity, and collaborative genius of such human interactions seem essential. Essential to the sorts of conversations we have here at the conference, to our work as a foundation, and to our collective efforts to make this planet a place for just, meaningful, and sustainable life. For this reason, the theme of next year's conference will raise hard but important questions. Humanity and artificial intelligence, AI, will be the topic of discussion at the 2020 SNF conference to be held here in Athens at the SNFCC as part of the Nostos, annual Nostos Festival. It's going to be Sunday to Sunday, June 21st to 28th. And as a parenthesis, as you all know, the race, which happens every year to those who run, is always on the 23rd of June. We make sure that the week incorporates that day. As you know, it's the world's Olympic Day. So this year we opened with a race because that was the 23rd Sunday. Next year it's going to be on a Tuesday, so it's going to be at the end, same time next year at the end of the conference. You'll have to get ready and run. So how do we balance going back to next year's theme, how do we balance the essential role of the human element with the power and potential of artificial intelligence? What is the best way possible for humanity and AI to collaborate to serve humanity at large? How can we achieve the best possible results for the many while at the same time minimizing collateral damage? How can we embrace AI's capabilities to transform our world without confusing change for progress, and most importantly, without tipping the scales away from the essential human element? How can we make sure that AI will serve humanity and not the other way around? As new technology permeates society almost without our knowing, there are moments of finding ourselves in utterly foreign territory, even to those of us who grew up with Huxley's Brave New World. Human contact is now a luxury good, asserted New York Times technology reporter Nellie Bowles, who will try to have her speak next year, earlier this year, arguing that tech use has shifted from being a marker of wealth to something that can only be avoided by the elite. She goes on to say, quote, "What we are seeing now is the luxurification of human engagement," end quote. And later she adds, quote, "There's also the reality that in our culture of increasing isolation, in which so many of the traditional gathering places and social structures have disappeared, screens are filling a crucial void," end quote. Privacy, long a default, is no longer so. Advancing AI is sure to take us in new, even stranger directions. Then again, perhaps it's a good time to assess whether pure IQ is overrated, while we, as humans, need to work more on embracing, cultivating, and evolving our EQs, our ability to handle and appreciate our own emotions and those of those around us. We do not need a predictive algorithm to tell us that with minds like yours, everybody who was here these last 2 days, and of course your humanity, the discussion is sure to be fascinating. I will close with a few words from Maya Angelou, quote, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." Thank you very much all for joining us for this year's annual conference, and we hope to see you again next year, June 21st. Thanks.